our first speaker, Dr. Catherine Field, who is a consultant occupational physician in private practice in Sydney. She consults to a wide variety of employers and industries in both the public and private sectors. She has interest and experience in assessing fitness for work, assisting employers and employees to successfully manage return to work after complex medical illnesses such as cancer. So, Dr. Catherine Field, over to you.
Thanks very much, Patrick. Hopefully everybody can hear me okay. So I'd just like to thank the organisers for asking me to be part of this panel. It's a great opportunity for me to be part of this, and also to qualify that I work at a private practice called IMEX, which is a private practice in Sydney, but just to qualify that the ideas and opinions that I express are my own and not necessarily those of IMEX. And to start off, I thought I'd probably just have a little just let you know what an occupational physician is, because there's not that many of us, and so a lot of people may not have know what we do and that we're a resource that can be used. But basically, an occupational physician is a specialist doctor, and we belong to a faculty which is part of the Royal Australian College of Physicians. And our specialty is basically assessing the effects of health on work and assessing the effects of work on health. Can I have the next slide, please? Thank you. So basically this is a busy slide, but this is taken from the faculty's position statement, realising the health benefits of work. And more, we're realising that work is generally good for health and well-being. And in fact, long-term work absence, work disability and unemployment have negative impacts on health and well-being. And the things that can really help with someone returning to work are the workplace practices, the culture, the work-life balance, what injury management programs the employer has, and the relationships that the worker has within the workplace are key determinants, not only of whether they feel valued and supported at work, but also it has a flow-on impact into their individual health and well-being outside of work. And after a period of injury or illness, it can be a complex situation with a lot of variables trying to get back to work. But the evidence shows that good outcomes are more likely when, first of all, the individual understands the health benefits of work, and also that their doctors understand the health benefits of work, and that they're empowered to take responsibility for their own situation in terms of getting back to work. Can I have the next slide, please? Thank you. So the role of the treating doctor in return to work is really central, and that might be your GP, or it might be your specialist, or it might in fact be both. And health professionals have a significant influence on work absence and disability, particularly with regard to medical sickness certification. So if the doctor and their patients recognise the health benefits of work, they're actually in a really strong position to be able to advocate for their patient and assist in the return to work process. And can I have the next slide, please? Thank you. So returning to work with or after cancer can actually be an important part of the recovery from cancer. And there are some benefits to returning to work, for example, improving and maintaining self-esteem and self-confidence after a period of illness. Work often provides social contact and support from colleagues and friends in the workplace. It helps people to maintain their vocational skills and knowledge so they don't de-skill too much after being out of the workforce. And of course, there's financial benefits of returning to work as well. And the thing that helps the most in return to work after illness is good communication between all the parties involved. So the GP, the patient, the employer, and any other health professionals involved that can help. Next slide, please. So I just thought I'd touch on a couple of specific issues with respect to cancer and return to work, and fatigue is a really common one. It's the most common side effect of cancer treatment, and it's reported by people during and after treatment. It can be related to all the different types of cancer treatment modalities, such as chemotherapy, radiotherapy, biologic agents, hormonal treatments, and even stem cell transplant. And The causes of fatigue are often multifactorial. It can be due to the cancer itself and the immune mediators the cancer releases. It can be due to nausea and vomiting, anemia, reduced appetite, disturbed sleep. Pre-existing medical conditions may be aggravated by the cancer or the cancer treatment. There can be side effects of medications, and psychological factors such as depression can contribute to fatigue as well. And the fatigue can be physical, emotional, and cognitive. And some people may have heard of the term chemo brain, which describes people feeling fatigued and having some cognitive fogginess and can't concentrate properly during and even after chemotherapy. And the treatment of fatigue involves pacing of activities and trying to remain active. And there's a place for exercise programs in cancer-related fatigue, which one of the following panelists is going to talk about a bit more. Next slide, please. Another specific issue with return to work and cancer is the psychological impact. And this, again, also can be multifactorial. There may be distress related to the diagnosis itself and the prognosis of the particular cancer. There are changes to identity and self-image as a result of the treatment of the cancer, a loss of self-confidence. There's impact sometimes on the family or the person's role within the family, and then cessation or interruption of the person's work and career. And these psychological impacts may be exacerbated, they may exacerbate fatigue further and or combine with fatigue to further impair functional capacity. Next slide, please. Thank you. So what can we do? Well, when as a doctor I'm assessing fitness for work, the things that I look at are, first of all, what are the inherent requirements of the person's job? What do they actually do day to day? How do they get to work? How long does it take them to get to work? And then I look at the person's functional capacity and then try and match the two up, essentially. And there are a number of workplace adjustments that we can look at to help people get back into the workforce. These can include changes to work hours or days or start times and finish times, for example, to allow people to commute outside of peak hour, which may mean a shorter or less work. Request assistance with travel to and from work, working from home, which is becoming easier, one of the upsides of the pandemic. Additional breaks, equipment or aids in the workplace to help with specific physical, functional issues, additional training or upskilling, and also education for employers, supervisors and colleagues about cancer in general or the particular cancer and how it may impact on the person's work performance. We can assist with regular reviews with the workers manager to plan future work, and also look at engaging external support such as a rehabilitation provider. The person may also need time to attend outpatient appointments, and that's important as well to discuss in adjustment of scheduled time off or allowing sick leave to make sure they can attend their appointments. Next slide, please. And so quite a few resources to assist in return to work. And so I've just listed a few here. In terms of your employer, human resources staff can assist you, return to work coordinators and supervisors. Most medium to large businesses will have a return to work coordinator. They're people usually in human resources or in OH&S who usually they work within the workers' compensation system to assist workers with work-related illnesses to get back to work. But they do also help people with non-work-related illnesses. And the advantage of a return to work coordinator is that they've had specific training in return to work. So they're a really good resource if your employer has a return to work coordinator. There are occupational physicians such as myself. There's a lot of us that work in private practice. Some work for particular organisations in-house, and some also work for public hospitals. And you can see an occupational physician with a referral from your GP or your employer. If you're referred by your GP, then you do get some of the feedback on Medicare. Unions are a good resource. Often they have people that can help. And if you have income protection insurance, either as your own insurance or within a superannuation fund, quite a few of the insurance companies now have in-house rehabilitation teams, and they can help with assisting the worker and their employer regarding temporary or permanent alternative duties, part-time work. They can help with vocational rehabilitation, job seeking. They can even help with specific cancer programs in terms of exercise programs and psychological support. And I know some of the insurers do have specific cancer recovery assistance programs. So they're another resource that you can tap into as well. Next slide, please. So that's about it from me. I've just given some references there. Just an overview of kind of the things that we look at in terms of returning people to work with or after cancer.